Hello, and welcome back to the 7 Steps to Starting Your Medical Exercise Training Practice in Any Setting. This is Dr. Michael Jones, President of the Medical Exercise Training Institute and the founder of the Medical Exercise Specialist Certification. This is step number 2. In this step, we'll talk about how to establish a signature program to build your medical exercise training practice. So, step number 2, establish a medical exercise or post-rehab signature program. Now, folks, the reason we talk about a signature program is because you have to have a product to offer medical professionals. And the signature program should be your version of a solution that you can offer the medical professional for a particular diagnostic group of patients that he or she may see on a regular basis in their practice. Folks, as I said before, I ran a physical therapy practice for a number of years. And you'll be surprised, physicians want solutions as well as other medical professionals. Now, for the most part, medical professionals produce solutions by using various components that are offered by members of the medical community. But as a medical exercise professional, what if you could actually put together your signature program, a program that you can produce, you can bet and guarantee you'll produce results for the individuals that come through your program? What if you put together one of those programs and market it to medical professionals? Say, for instance, you have a bit of expertise in working with lumbar clients, or you've taken a few extras workshops in dealing with knee disorders. Now, the key thing with a signature program is it's a program that's offering a solution. It allows you to work with the client to reach their maximum level of function after physical therapy, chiropractic, and medical care are done. And it's a solution in that it offers lifestyle education as well as exercise and anything related to exercise, but it offers no medical treatment. So with the signature program, you're going to actually promote this to medical professionals. You're going to actually put together a flyer and promote it to medical professionals. I'll give you an example of a signature program in just a moment. You can also market this directly to post-rehab clients. Now, let me make sure we're clear on this. Post-rehab clients are individuals who receive the maximum benefit from physical therapy and or chiropractic services or other medical services. They've been discharged, and these individuals have significant residual functional deficits, but they do not indicate significant red flags when you perform your assessment or screening of them when they come to your program. So these individuals are no longer in need of medical services. They just need a structured, protocol-based, safe and effective exercise program. Now, we recommend that the packages be finite or the solution be finite. What we mean by finite is for a specific period of time. Folks, I can tell you, in our early years of offering the medical exercise specialist certification, when we did discuss the details of the program and the concept of medical exercise training and post-rehab fitness to medical professionals, we found one of their concerns was the idea that they would refer their patient, Mrs. Smith, who was 69 years old with a total hip replacement. They refer her to a gym, but the gym would lock her into a year-long contract. Now, we all know that a year-long contract is a standard commitment in the fitness industry. But for the medical professional, they only wanted their patient / your client to be in the facility for maybe 3 to 4 months. So they were looking for a finite solution. So your packages or solutions should be finite, educational based in that they should have a lifestyle educational component that goes along with them, and also have exercise structured in. Now, an example of our MedFit group training programs that we offer at the Medical Exercise Training Institute is our Dynamic Back School. It's a 30-day, 6-session program that includes both a lifestyle education component, teaching clients with lumbar disorders how to lift, push, pull, and carry and with proper lumbar dynamics, as well as providing an exercise, a structured exercise program in a group setting. So the lectures and the exercise is given in a group setting. We also have a total joint and arthritis program, and it's for individuals that have arthritic hips and knees or have undergone total joint replacements and now receive hip or knee prostheses, or for individuals that are seeking to have the surgery done. So we actually lump those individuals into one group. And as I said before, the programs are over a 30-day period, so there's 6 days, 6 sessions, I should say, over a 30-day period. We also have a hypertension diabetes, and obesity program. So we find these programs we can now market directly to medical professionals. So we can market our dynamic back school. We market that to physical therapists, chiropractors, orthopedic surgeons, and neurosurgeons. Our total joint and arthritis program, we market that to physiatrists, rheumatologists, orthopedic surgeons, as well as physical therapists. And our hypertension, diabetes, and obesity program, we market that to endocrinologists, internists, cardiologists, general and family practitioners, as well as diabetes educators. So we find that these programs are offering solutions to the conditions or diagnoses that medical professionals are seeing, and it provides both education and exercise. So we're going to educate them as well as exercise them. And we do market these programs directly to post-rehab clients. Because folks, after physical therapy is done and the client isn't up to 100% full function, they're out there looking for solutions, and they're looking for solutions not in the yellow pages anymore. They're looking for solutions on the internet. So now, develop your signature program with medical professionals and their patients in mind. Now, as fitness professionals, you now must start to think in terms of diagnoses and conditions. You can't say the client has a shoulder problem or the client has knee issues. In the medical community, every thought is of a specific diagnosis. Once we have a diagnosis, that then determines the treatment process. Now, you're not providing any aspect of treatment, but you have to be on the same guidelines with regard to terminology and discussion that medical professionals are. And we don't think in terms of issues or conditions, and when I say conditions, a shoulder condition, we speak in terms of specific diagnoses. And when you communicate with medical professionals, you need to do that. You should think in terms of how your programs as a fitness professional, how can you develop, create, and offer programs that help medical professionals better manage their patients. And you have to make sure you understand their needs. You have to understand the medical professional's needs. And as I said before, an example is our Dynamic Back School program. As I said, this is a 30-day program that offers 6 sessions to the individuals participating in the exercise program, 6 sessions over 30 days. Each session is about an hour and 15 minutes in length. The first 15 minutes is a short lecture done by one of our medical exercise specialists using a PowerPoint presentation on topics that are related to their particular diagnosis. And again, this is a group setting. We take up to 10 participants. They all have related medical conditions. And after the exercise segment is over, then they'll enter an hour of exercise. Now, we find for a lot of people, when you tell them they're entering a program where they'll exercise for an hour, they're overwhelmed and they're really concerned and alarmed. But for the most part, the hour of exercise, especially the first 3 to 4 sessions, is teaching these individuals how to perform the exercise. So we assure the individuals coming in that the exercise segment is not a continuous hour, but is actually an hour of exercise and exercise education so they can become independent at home on their own with exercise. Again, an example is our Dynamic Back School. And if you want to get more information on that, go over to medfitgrouptraining.com, and we have plenty of information there. Now, again, we offer our medical exercise training certifications. Our medical exercise program director is for the individual that wants to manage, supervise, and market a medical exercise training program to the medical community and the community at large. The medical exercise program director serves as the liaison between the medical community and the fitness or medical exercise training facility. Our medical exercise specialist certification has been around for 24 years. It is the longest standing medical exercise related certification, and we have more certified individuals than any other organization and in more countries around the world. Our medical exercise specialist program consists of 44 hours of video education, some 2,000 pages of handouts, protocols, and manuals, and it is the most comprehensive and thorough program for a medical exercise professional there is on this planet. Our entry-level program is our post-rehab conditioning specialist program, and you can get information on all of these programs at postrehab.com. And if you have questions for me related to this presentation, please email me at drmike, at postrehab.com. Please also look at the link below this video. There's a link here where you can actually download the 7 steps to building your medical exercise practice ebook, and it will have all 7 steps that are included in the ebook. Thank you again for listening. And again, if you have questions, email me at drmike@postrehab.com.